Hello Invisalign fans! If you've been following along, you'll know that I've been blogging my Invisalign experience with Dr. Shen Garnett in San Francisco. I haven't been trying to give you too many technical details about my orthodontic treatment, but rather an impression of what your own Invisalign experience might be like with Dr. Shen Garnett. To that end, I realized it was difficult for me to film myself while undergoing treatment, so I decided to interview some team members, Dr. Shen Garnett herself, and also follow along young William as he underwent his own orthodontic treatment over the last year. I'm very pleased with my own Invisalign treatment, so stay tuned to the end to see the final results.
So my name is Megan. I have been here for about 2 years and I am the treatment coordinator for Dr. Shen Garnett. In my position, I'm trying to make them comfortable with the office. I'm trying to familiarize them with the office by giving them a tour and introducing them to the assistants and the doctor. I'm also there to educate them and explain anything that needs explaining.
When William first came to visit us, he was interested in Invisalign Teen, as most teenagers are, for the aesthetics and the comfort. And after discussion with his mother, they agreed on clear braces as a compromise.
I'm pretty excited to see what's to come, and I think taking the x-rays is pretty cool.
Yes, so we do indirect bonding at our practice if possible. If all the teeth have come in and they are not growing in any further, we'll take molds of the teeth, and then outside of the patient's mouth, I will put the brackets on and center the teeth and compare it to the x-ray so that the root positions will be parallel at the end. And that will save chair time, make it more comfortable for the patient, and allow me more precise precision placement of the brackets.
I don't know, I'm pretty nervous because I've never had braces before, so this is my first time.
My name is Rosalie, and I am Dr. Shen Garnett's dental assistant for the past 6.5 years. Of course, the number one thing that we do when they sit in the chair, first off, is to make them feel comfortable. But we usually just get to know the patients first, just chit-chat for just a few minutes, just get to know them so we know who they are. And before we do anything at all, we explain everything of what we would do next. So instead of just getting straight to work, just fixing their teeth, we would explain like every step.
So the brackets are placed on the models, and then we make a set down tray and a template so that when he comes in, we just have to put the template on like the brackets instead of having to position each bracket one by one in the mouth, which is a little bit more uncomfortable and takes longer. It's just as much time for me. It's actually more work for me to do the indirect bonding. It's twice as much work, but when the patient's there, it saves about 15 to 20 minutes of him opening his mouth and having me place the brackets. And the chances are for placing brackets directly one by one on the back teeth of getting the bracket not centered is a lot higher.
Yep, I got braces on, and it went really well actually. I didn't think it was, before I actually got them, I thought it was gonna hurt putting them on. It didn't at all. They did a really good job of putting them on. I didn't feel anything. Today they're just gonna change the wire that's in my mouth, and I have a loose bracket in my mouth, so they're probably gonna replace that bracket with a stable one.
Well, I train all my staff, so they treat their customers the way I would want to be treated. So patients always come first, and I'm here to answer any questions. So the key is communication, because I can't read patients' minds. So if they have a concern, they need to bring it up to me. But if they bring it up to me and I can see eye to eye with them, I can definitely address all their concerns. And with orthodontics, I like to see results efficiently. I don't like to wait 2-3 months before I have the patient come back. So I like to have my patients come back every 4 to 6 weeks instead of every 6 to 8 weeks so that I can monitor their progress, make sure they're not falling behind so treatment gets done on time.
Today they're gonna take my braces out, which is for me extremely exciting, I really look forward to this moment. Even though I've had them for only a year, I'm still very excited to finally get them out.
All right, so let's have a look. How are you feeling?
Good. It feels really slimy right now, not the brackets, but it's I'm so happy right now.
So, back to my own treatment. There are a couple of choices to be made at the end of the main course of treatment. I chose to have a wire bonded to the back of my upper and lower front teeth that act as a retainer during the day, and at night I wear an Invisalign tray that also acts as a retainer. So here's the end result. After a little more than a year, my bite is better, my teeth are straighter, and I can walk out into the world with a confident smile. I can't stress enough how pleasant my experience was at Dr. Bella Shen Garnett's office. The appointments were efficient, the staff is friendly and knowledgeable, and I couldn't have been happier with the results. Thanks, Bella.